the channel. I wanted to make a quick video today on pectineus or upper adductor stretching. The pectineus muscle is a common cause of groin and anterior leg pain. The reason for that is that when you bend forward, if you have a really tight groin, you can develop something called pectineo-femoral pinch syndrome. I published an article on this on my website. It's basically a phenomenon where if you have very tight groin muscles, when you bend forward, it lifts the nerves that pass under the inguinal ligament. So that will be either inguinal nerve, genitofemoral nerve, femoral nerve, and of course that can affect the staphnous nerve as well, and the lateral femoral cutaneous nerves, guys. You bend forward, if the groin is very tight, it will lift the nerves and compress them to the inguinal ligament. It can cause all kinds of crazy, it can cause anything from mild pain in the leg, mild groin pain, to severe, aggressive neuropathic pain in the leg, in the groin, testicle, anterior labia, and it can cause weakness of the legs as well. I have seen patients who come in limping on the leg. You test the myotome, let's say it's the right leg affected, you check the strength of the right quad, extremely weak. Look at the back and right, it's normal, and then you test the left leg and the strength is normal. Sit them straight for a while, have them leaning back, test them again, strength comes back. You put them into flexion again, for example, sit them in a squat for a couple of minutes, and now the leg is weak again, and of course it reproduces the pain, either immediately during the provocative maneuver, or within minutes after the test has been done. So today I'm going to talk, the point of this video was to show you a stretch for the pectineus, which is one of the treatment strategies for pectineo-femoral pinch syndrome. The pectineus is the upper and most proximal adductor, as some of you might know. This stretch will also affect the adductor brevis, adductor longus. The point is to really get those proximal adductors to stretch them. So I recommend doing this stretch, similar to the pec minor video, 60 seconds to 2 minutes, 2-3 times per week is usually good enough. You can do it before the gym if you're going to squat, if you're going to do lower body. Personally, I prefer to do it the night before, but you can find out what works for you guys. Anyway, I will show you the stretch now. All right, guys, so when you're going to stretch the upper adductor groups, proximal adductors, what's really important, and especially if you have this nerve impingement problem, is that you don't go all the way into 90 degrees. You want to bend at the knee, and you want to stretch, you want to horizontally abduct the leg at about 45, 50 degrees, maybe 60, but it depends on your flexibility. I will show you now with one leg at a time. You can do this with both at a time as well. For example, you could go down on the floor on all fours and just spread your legs out to the side at about 45 degrees of hip flexion. But I prefer to do it like this. This is also useful if one of your hips have a greater degree of hip impingement, for example. So I flex the hip. If this is straight, then I will flex the hip to about 45 degrees. This is probably around 45 degrees. Might not be so easy to see. And I simply lean into it, right? Or I pull my hips down to get that deep stretch in the upper groin. Hold that position for a good couple of minutes, and then I change sides. You don't want to have worsening of symptoms afterwards. If you have worsening of neuropathic symptoms after the stretch, either straight afterwards or hours afterwards for that matter, or the day after, guys, then you need to reduce the hip flexion angle. Because if you put yourself in a position where you increase the compression of the nerves, you're going to feel worse, even though you are technically making the muscle better. Another thing that you want to be aware of, guys, is that if you have hip impingement, how do you know? Well, generally, if you go into abduction, so during the test, so to say, during the stretch, if you feel like a deep mechanical pinch inside of the hip joint, that's probably hip impingement, guys. You don't want to force yourself into a position of hip impingements. If you get that, You can try to play around with the flexion angle a little bit to see if you can find a position that impinges less. If you can't though, just go to the degree right before the impingement happens and just stretch there. And if it doesn't stretch, so be it, because you can't put yourself into a hip impingement position. That will, well, it will speed up the development of arthritis in the hip. But if you don't have any impingement symptoms, then you can just stretch as far as you want, as long as it doesn't frankly hurt. Just make sure that you don't get any nerve symptoms during or after you've done this. And remember, the symptoms can come hours afterwards sometimes. So just be aware of that, guys. I hope this video was helpful. I also recommend to combine this with strengthening of the hip abductors, especially the gluteus minimus, guys. So that's the treatment for, well, it's a part of the treatment for hip impingement if you have a restriction in abduction, and part of the treatment for pectineo-femoral pinch syndrome. So hope it was helpful. Have a great night, guys.